Many men notice gradual changes in energy, sleep, and recovery as they move through their 50s and beyond. Often, small daily habits may influence these patterns more than people realize. I'm Dr. Hina Kim, and continuing to learn about healthy aging can be an important step towards supporting long-term wellness and daily quality of life. Dr. Hina Kim, men's health and wellness specialist. When men enter their 50s and 60s, one of the most common concerns I hear about is low daily energy. Many people notice they feel more tired in the afternoon, less motivated to stay active, or slower to recover after physical activity. In many cases, this is not caused by just one issue. Energy levels are often influenced by several small lifestyle habits working together over time. One important area to look at is sleep quality. As men age, sleep patterns naturally change. Some people wake more often during the night, while others sleep for enough hours but still do not feel rested in the morning. Poor sleep can affect focus, mood, physical stamina, and even appetite regulation during the day. For many adults over 50, improving sleep habits may support more stable daily energy. Simple habits can help, including keeping a consistent sleep schedule, limiting heavy meals late at night, reducing screen exposure before bed, getting natural sunlight earlier in the day. Nutrition also plays a major role. Some men unintentionally skip balanced meals or rely heavily on processed snacks and sugary drinks for quick energy. While these foods may create a short boost, they are often followed by energy drops later in the day. A more balanced eating pattern may help support steady energy levels. In general, meals that include lean protein, fiber-rich vegetables, healthy fats, whole grains, may help the body maintain more consistent fuel throughout the day. Hydration is another factor that is commonly overlooked. Even mild dehydration may contribute to fatigue, headaches, or lower concentration. Many adults simply do not drink enough water during busy workdays or while traveling. Physical activity is equally important. Some men believe they should avoid movement when they feel tired, but in many situations, regular movement may actually support better circulation, mobility, and overall energy. This does not always require intense exercise. For many adults over 50, consistent activities such as walking, light strength training, stretching, cycling, swimming, can be helpful parts of a long-term wellness routine. Muscle health also becomes more important with aging. After age 50, the body naturally begins to lose muscle mass more easily if physical activity decreases. Maintaining muscle strength may support balance, daily function, and overall vitality as the years progress. Stress can also quietly affect energy levels. Ongoing mental stress may influence sleep quality, eating habits, and physical recovery. Many men focus only on physical health while ignoring emotional strain, work pressure, or long-term fatigue from daily responsibilities. Creating time for relaxation, social connection, outdoor activity, hobbies, regular routines may support both mental and physical wellness. It is also important to remember that persistent low energy should not always be ignored. Sometimes fatigue may be associated with common age-related health changes involving sleep quality, hormone balance, blood sugar, heart health, nutrition deficiencies. That is why regular medical checkups remain important, especially after age 50. A healthcare professional can help evaluate overall wellness and determine whether lifestyle adjustments or further evaluation may be appropriate. Healthy aging is usually not about one dramatic change. In many cases, it involves small consistent habits repeated over time. Better sleep, balanced nutrition, regular movement, hydration, stress management, preventive health awareness. These daily habits often work together to support long-term energy, mobility, and overall quality of life. And for many men, understanding these gradual body changes is an important part of staying active and feeling well as they continue aging. Another area that deserves attention after age 50 is daily routine consistency. The body often responds better when sleep, meals, movement, and relaxation happen at relatively stable times throughout the week. Irregular schedules may contribute to fluctuations in appetite, energy, and focus for some adults. Morning habits can also influence how energy feels during the rest of the day. Exposure to natural daylight early in the morning may help support healthy sleep-wake patterns and daytime alertness. Some men also notice that beginning the day with light movement, stretching, or a balanced breakfast helps reduce sluggishness later in the afternoon. Digestive health is another part of overall wellness that is sometimes overlooked. As the body ages, digestion and nutrient absorption may gradually change. Eating too quickly, overeating late at night, or relying heavily on highly processed foods may leave some people feeling uncomfortable or fatigued after meals. Many adults benefit from slowing down during meals and paying closer attention to portion balance and food quality. Including foods rich in fiber may support digestive regularity and overall metabolic health. Caffeine habits are also worth reviewing. While coffee and tea can be part of a healthy routine for many adults, excessive caffeine intake later in the day may interfere with sleep quality at night. Some individuals experience a cycle where poor sleep leads to higher caffeine intake, followed by even more disrupted rest. Creating healthier evening routines may support better overnight recovery. This can include reducing unnecessary screen time, limiting heavy late-night snacking, keeping the bedroom cool and comfortable, allowing time for mental relaxation before sleep. Joint comfort and flexibility also become more important with age. Many men reduce physical activity because of stiffness or mild discomfort, but completely avoiding movement may sometimes contribute to further loss of mobility over time. Gentle daily mobility exercises and regular stretching may help support flexibility and physical function as the body ages. Social health is another important part of long-term wellness. Staying socially connected through family, friendships, hobbies, or community involvement may positively influence emotional well-being and daily motivation. Healthy aging involves both physical and mental wellness working together. For some adults, small improvements in routine, movement, hydration, sleep habits, and nutrition may gradually contribute to better overall energy and daily function over time. And understanding these patterns early may help many men make more informed lifestyle choices as they continue moving through their 50s and beyond. Another factor that may influence energy after age 50 is recovery time. Many men notice that the body may take longer to recover after poor sleep, travel, physical labor, or periods of high stress. This gradual shift is a normal part of aging for many adults, which is why recovery habits become increasingly important over time. Allowing adequate rest between demanding activities may help support overall stamina and physical comfort. This does not mean avoiding activity altogether. Instead, it often means balancing movement with proper recovery and consistency. Protein intake also becomes more important with age. Adequate protein as part of balanced meals may help support muscle maintenance and overall body function. Some adults unintentionally consume less protein over time, especially when appetite patterns change or meal routines become inconsistent. Including balanced protein sources throughout the day may support healthy aging when combined with regular physical activity. Posture and daily movement patterns can also affect how the body feels. Long hours of sitting, driving, or screen use may contribute to stiffness, reduced mobility, and physical fatigue. For many adults, taking short movement breaks during the day may help support circulation and reduce prolonged inactivity. Breathing habits may also influence stress and tension levels. Some individuals develop shallow breathing patterns during periods of stress or mental overload. Simple relaxation techniques, quiet walks, and mindful breathing exercises may help support a calmer physical state during busy days. Routine preventive care remains another important part of long-term wellness. Regular monitoring of blood pressure, cholesterol, blood sugar, sleep quality, and weight changes may help individuals stay more aware of their overall health patterns as they age. Preventive awareness is often more effective when approached gradually and consistently rather than only reacting after symptoms become disruptive. It is also helpful to pay attention to how lifestyle habits interact with one another. For example, poor sleep may affect food choices. Reduced activity may influence mood and stamina. Dehydration may worsen fatigue. Stress may disrupt recovery and concentration. Because these habits are connected, even small adjustments in one area may positively influence other parts of daily wellness over time. Healthy aging is often less about perfection and more about consistency. For many men in their 50s and 60s, maintaining regular habits, staying physically engaged, supporting mental well-being, and remaining proactive about health awareness may contribute to better long-term quality of life and daily function. Environmental habits may also influence how energy levels feel throughout the day. Spending long periods indoors with limited natural light and minimal movement may contribute to feelings of sluggishness for some adults. Regular outdoor activity, even in short durations, may support mood, circulation, and general alertness. Fresh air and moderate sunlight exposure can also help reinforce healthy daily rhythms tied to sleep and wake cycles. Meal timing is another area worth paying attention to. Large gaps between meals or excessive late-night eating may affect how stable energy feels during the day. Some adults benefit from maintaining more regular meal patterns that support steady nourishment without overeating. Alcohol intake can also influence recovery and sleep quality. Even moderate evening alcohol consumption may affect overnight rest for some individuals, particularly as the body becomes more sensitive to sleep disruption with age. Awareness of these patterns may help individuals better understand why they feel tired despite spending enough time in bed. Healthy body composition also becomes increasingly important after age 50. Changes in muscle mass, activity levels, and metabolism may gradually affect weight distribution and physical endurance. Rather than focusing only on body weight, many healthcare professionals encourage attention toward strength, mobility, cardiovascular fitness, flexibility, sustainable daily habits. Consistency with movement often matters more than intensity alone. For many adults, moderate activity performed regularly is easier to maintain long-term than extreme exercise routines that are difficult to continue. Mental stimulation is another valuable part of healthy aging. Reading, learning new skills, social interaction, problem-solving activities, and engaging hobbies may help support cognitive wellness and emotional balance over time. Many men spend years prioritizing work responsibilities while delaying attention to personal wellness routines. However, healthy aging often becomes easier when preventive habits are incorporated earlier and maintained consistently. It can also be helpful to monitor how the body responds to changes in routine. Paying attention to sleep quality, appetite changes, recovery time, physical endurance, mood fluctuations, concentration may provide useful insight into overall wellness patterns. These observations can help guide productive conversations during routine medical visits. In many cases, long-term wellness is built through practical daily decisions rather than dramatic short-term efforts. Small sustainable habits repeated consistently over months and years may have a meaningful influence on physical function, independence, and quality of life as men continue aging. Another important aspect of wellness after age 50 is maintaining daily mobility in ordinary activities. Simple movements such as climbing stairs, carrying groceries, standing from a seated position, or walking longer distances can gradually become more challenging when physical conditioning declines over time. Maintaining functional strength may help support independence and confidence in everyday life. Balance is also an area that deserves attention with aging. Regular movement activities that support coordination and stability may help the body stay more adaptable during daily tasks. For many adults, this may include walking on varied surfaces, gentle resistance exercises, stretching routines, low-impact fitness programs, posture-focused movement. Healthy circulation also plays a role in overall energy and comfort. Long periods of inactivity may contribute to stiffness, reduced movement, or feelings of fatigue during the day. Even short periods of standing, stretching, or walking throughout the day may help support circulation and physical alertness. Nutrient quality becomes increasingly important as calorie needs sometimes decrease with age. This means food choices may have a greater impact on how the body feels and functions. Many healthcare professionals encourage focusing on nutrient-dense foods that provide Vitamins, minerals, protein, healthy fats, fiber. Rather than relying heavily on highly processed convenience foods. Appetite patterns may also change over time. Some adults eat less during the day and consume larger meals late at night, which may affect digestion, sleep quality, and next-day energy. Creating more balanced meal timing may help support steadier physical function throughout the day. Emotional wellness should also remain part of the conversation around healthy aging. Life transitions involving retirement planning, family responsibilities, financial stress, or changing routines may influence emotional health in subtle ways. Mental well-being and physical health often influence one another more than many people realize. Maintaining meaningful routines, staying socially engaged, and keeping physically active may all contribute to overall wellness as men grow older. It is also helpful to approach health information carefully. Many advertisements and online trends promote dramatic solutions for fatigue or aging-related concerns. However, sustainable wellness usually depends more on long-term habits than quick approaches promising rapid results. Building supportive daily routines gradually may be more realistic and easier to maintain over time. In clinical settings, one of the most valuable long-term habits is consistency. Regular sleep patterns, balanced nutrition, movement, hydration, preventive care, and stress management often work together in ways that support healthier aging across many areas of life. And for many adults over 50, staying informed about these everyday health habits may help create a stronger foundation for long-term physical and mental well-being. Healthy aging also involves adapting wellness habits as the body changes over time. Routines that worked well in earlier decades may need gradual adjustment during the 50s and 60s to better support recovery, mobility, and daily energy. For example, some adults benefit from placing greater focus on flexibility, joint comfort, and recovery instead of only high-intensity exercise. Warm-up and cool-down routines may also become more important with age. Preparing the muscles and joints before physical activity may help support comfort and movement quality during exercise. Recovery afterward is equally valuable, especially when physical activity is increased after long periods of inactivity. Daily posture awareness may also influence physical comfort and energy levels. Extended sitting, poor workstation positioning, or reduced movement throughout the day may contribute to neck tension, back discomfort, and physical fatigue. Simple adjustments in posture and movement habits may help support overall body mechanics during routine activities. Heart health awareness remains another important part of long-term wellness. Maintaining healthy lifestyle habits such as regular movement, balanced nutrition, stress reduction, smoking avoidance, routine medical evaluations may support cardiovascular wellness over time. Sleep environment can also influence rest quality more than many people realize. Noise, excessive room temperature, irregular schedules, and nighttime screen exposure may all interfere with restorative sleep patterns. Creating a more calming evening environment may help support more consistent overnight recovery. It is also common for adults over 50 to experience shifts in motivation toward exercise or wellness routines. Rather than aiming for perfection, many healthcare professionals encourage focusing on sustainable routines that feel realistic and manageable long-term. Even moderate lifestyle adjustments maintained consistently may provide meaningful support for overall well-being. Travel, work schedules, and family responsibilities may also affect routine stability. During busy periods, maintaining simple foundational habits such as hydration, walking, regular meals, and sleep consistency may help reduce feelings of exhaustion and physical strain. Awareness of as we age, it becomes increasingly important to pay attention to the small daily habits that support overall wellness. Consistent sleep, balanced nutrition, regular movement, hydration, stress management, and preventive health awareness may all contribute to maintaining energy and physical function over time. Healthy aging is rarely about perfection or dramatic changes. In many cases, it is the result of steady routines and long-term consistency. I'm Dr. Hina Kim, and I encourage you to continue staying informed, staying active in ways that feel appropriate for your body, and working with your healthcare professionals to support your long-term well-being as the years continue ahead.